Mommy, privacy.
I know.
Great. Hello, everybody. Welcome to our newest webinar, which is about understanding and managing challenging behaviors in children. Today, we have a BCBA and an occupational therapist that are going to be presenting with us. So we'll just go ahead and get started here. So first off, just a little bit of information about North Shore Pediatric Therapy. We have 12 different locations throughout the Chicagoland area, including our brand new Woodridge location, which is going to be opening in the next couple weeks. Our services include applied behavioral analysis, or ABA, speech and feeding therapy, occupational therapy, mental health services, physical therapy, and then neuropsychology, including our early autism testing clinic. And then we have our information below where you can contact us to learn more about our specific services or to actually start services. You can also visit our website for more information at nsptforkids.com. And then I'm going to introduce our presenters today. We have Callie Gilsonen, who is our BCBA today. And then we have Sierra Jones, who is an occupational therapist, and she's also our clinical director of OT and PT here at North Shore Pediatric Therapy. And then today's agenda, what we're going to start with is going through what challenging behaviors are, what behaviors might need additional support, and then we'll pass it off to Callie to talk about insights and strategies from her perspective as the BCBA. And then we'll pass it on to Sierra to do insights and strategies from an OT perspective. Then they're going to run through some practical scenarios, and then we'll share some parent resources. Then at the end, we'll go through a question and answer. So throughout the presentation, if you have any questions that come up, feel free to use the chat feature. And then at the end, we'll go through and we'll read some of those questions and have that for our presenters today. So let's go ahead and move forward. And I'm going to pass it off to Callie.
Hi, everybody. So to get started, I think it's important to know some background information on the topic. So challenging behavior is defined as behaviors that interfere with an individual's ability to learn, engage in activities, and maintain a safe and positive environment. Some behaviors that may come to mind include hitting, biting, tantrums, headbanging, and impulsive actions. A way to view if a behavior is challenging is also to kind of take a step back and identify if it's harmful to themselves or to others. And then I'd like to segue into a little bit of a disclaimer. Every human and every situation is unique. There are very many environmental factors that may impact a child's learned history and their response to the intervention. It's always important to first rule out any medical concern above all else. So if your child has any behaviors that are self-injurious, they hurt themselves, or aggressive in nature, I do recommend that you consult with a professional. So an ABA approach to challenging behaviors focuses on the function of the behavior or why they happen rather than labeling them as just problematic. Thank you, Tessa, sorry. As I previously mentioned, there are many factors that impact human behavior. The skills I'm talking about are the basic strategies that families and clinicians use to help decrease challenging behaviors. And I'll be reviewing why the behaviors happen, a tool to identify why, so ABC data, and strategies that you can use both to prevent the behaviors and de-escalate and reduce them in the future after they've already happened. So there are four main functions of behavior. So the why the behavior happens. There's attention, escape, access to tangible, and then automatic or sensory seeking. To start with attention, it's when a person engages in behaviors to reduce or to receive attention from those around them. So I wanted to provide an example for kids and also their parents to help put it all into perspective. A common example for kids could be maybe yelling or interrupting conversation. An everyday example for adults could be maybe exaggerating a story or making a controversial statement. Then we have escape or avoidance, which is when someone is trying to get out of doing something that they don't want to do. My example for the kid would be when it's time for bed and all of a sudden they're asking for water, they want a story, they want a hug or to be cuddled. looking at it from an adult's perspective, sometimes I don't want to go to bed and I find myself scrolling on my phone, doing something I don't even care about, watching videos that I wouldn't otherwise be watching. Next is access to tangibles. So this is when a person might engage in the behavior to get access to an item, a person, or an activity. An example for kids could be wanting a toy that someone else has, so they push them away and scream. An example for an adult could be maybe guilt tripping, lying, whining to their partner to get something that they want. And then finally, there's automatic or sensory seeking. This is when a person does something because it provides a pleasant stimulation, or in other words, it feels good or feels interesting. An example for kids could be maybe they're picking at their skin or jumping from a high chair. And an example for an adult could be just kicking your foot when you're talking, clicking a pen, maybe twirling your hair. Behaviors can happen with just one of these functions, but it also can happen with multiple of these functions. So for example, maybe playing on my phone could be a combination of sensory seeking because I'm watching some fun videos. It also can be escape because I'm not doing the chores that I'm supposed to be doing around my house. Next, we have what's called ABC data. So to figure out the function of the behavior, so why it happens, we often utilize something called ABC data. So the A stands for antecedent, which is what happened right before, or what is in the environment that's taking place right before the behavior occurs. B is the behavior, so what happened. And then C stands for consequence, which is what happened and what the environment was like right after the behavior. It's important to note that consequence, although it sounds like it would be a punishment, it can be literally anything that happened or what was in the environment after. Even if you just gave them a treat, that could be a consequence. By writing this information down each time the behavior happens, we can see different patterns that happen. Looking at a behavior in different ways can give you the full picture for how and why. For example, let's say if a child is screaming every time they see candy in the grocery store, I may assume they're screaming because they want the chocolate bar. So I would assume it is access to tangibles as their function or why it's happening. After writing it down and seeing the before and after, maybe I can see that it happens whether or not they have a candy. So all along, maybe the behavior's function was the attention that they got when they screamed. So now for the intervention, starting off with the most important way to set yourself up for success. What can I do ahead of time to prevent the behavior? Based on the function or the why, you can find an alternative way for your child to communicate or satiate their wants and needs. Looking at the functions of behavior for attention, if your child engages in behaviors to seek attention, you can be sure to give attention throughout the day, not just when they ask or seek it out. You can also model different ways to gain attention, such as tapping shoulders for you to join them, and maybe having visuals to show when you are or not available. Be sure to honor appropriate requests when they ask as well. So if you are able to take some time out of your day to just honor any requests that they make so that they get that reinforcement and they can see the right, the more appropriate way to ask opposed to something such as, hitting or screaming. Escape, if your child engages in behaviors to escape or avoid tasks, you can help prepare them for the tasks by giving them clear expectations. A visual or verbal schedule can help, giving them choices, as well as always following through with the expectations placed so that they can trust that you're going to have that consistency. It's beneficial to also limit the distractions in the environment prior to beginning the task, if especially if it's something that they wouldn't like. And then for tangible, so if your child engages in behaviors to gain access to something, you can model and teach appropriate requesting. So this can be through touching, pointing, gesturing, saying, or any way that they're able to communicate. Model the language and honor any instance of appropriate requesting. You can also utilize verbal and visual schedules and timers to help give a clear understanding of when they will have access to the item. And then for sensory, if your child engages in behaviors to gain access to sensory stimulation, you can pay attention to unsafe behaviors they may be doing so you can find an alternative that gives them a similar feeling in a safe way. So that could be, for example, if your child mouths on objects that are unsafe, you can provide different things such as chewies or maybe even suckers or some kind of candy or certain thing, that feels good for them to chew that is safe. Now moving on to what to do after the behavior occurs, because it will happen. They are kids. And whenever it does happen, just remember to remain calm and be intentional in your responding. Take care of yourself and give yourself grace. We are only human. I'm going to use the functions of behaviors to describe some ways to respond based on why the behavior is happening. I'd also like to note that the priority should be to ensure safety. So if there are potential dangers in the environment, be sure to remove them or place yourself at a safe distance or in a safe position for any kind of behaviors that are aggressive. For any challenging behaviors, it's important to remain calm and neutral in your expression and then minimize some demands. In some cases, it's beneficial to reduce the amount of talking you're doing. BCBAs and ABA practitioners often will use a safety care de-escalation training, which is called WAIT, which stands for Why Am I Talking? Also, with any strategies you use, it's helpful to model appropriate behaviors. And then refrain from providing someone asked if the slide is supposed to look like that. No, it's not. Refrain from providing access for tangible maintained behaviors. And then model appropriate ways to request and honor the child's appropriate requesting. If it's something that they aren't able to have access to, you can remove the item from the area and remain neutral in responding. For sensory seeking, if there are alternative options available, block access to the dangerous or unsafe sensory seeking behavior, and then provide an alternative. Maybe throw them a party in whatever way feels good to them whenever they are engaging in the alternative safe way to seek some sensory stimulation. And now on to Sierra.
All right, guys. So I'm going to give a little bit more insight information from that OT perspective. All right, we can go to the next slide. Awesome. So kind of going back to the why, behaviors are an expressive act, right? So kind of like Callie was mentioning about how there's functions of different behaviors. It's because a child is trying to communicate. Humans, we all do that, right? We have different ways that we express ourselves through behaviors. And one thing to remember is that whether behavior is considered appropriate and acceptable really depends on the context and the social norms of the situation. So take, for example, if a kid is in a classroom and the teacher hands out some homework, the kid sprints out of the class and goes to the playground. In that instance, with that context and everything, that's not an appropriate behavior, and that's not an appropriate time to go do that. But think about that same situation again. Think about if the kid runs out of the classroom, the recess bell rings, and then the kid runs out of the classroom. That's like an appropriate time to do that. So just keep in mind that there's a lot of different varieties of behavior and things that we see, and whether we think that those are appropriate depends on the situation that we're in. So your child might be expressing themselves or using behaviors that are appropriate. It might just not be in the right context. And so we use kind of education and self-regulation to help with those things. So another thing I kind of like to think about here too, for the why of behaviors that we see is kind of thinking of it like an iceberg, right? So we know icebergs are massive. And when you are out and you see them, you only see a small chunk of the iceberg. So when we look at a kid having behaviors, we're able to see like the observable things, right? If the kid's, head banging or screaming and crying, or like running around, not listening to our instructions, things like that. You have some objective information about maybe how they're feeling for the day. You have the age that they are, whether that's an appropriate response at their age if they've learned yet. You have like parenting styles that kind of impact those things. But then you have all these other things underneath the iceberg that are also helping and like causing and helping with the impact of why of things that you might not always think about. So there's things like trauma that impact what our behaviors are. There's things like, people who are neurodiverse, their brain works a little bit differently. So you have those pieces involved as well. There's also internal indicators of stress and recovery. And there's also sensory like regulation, which is something that we don't outwardly see all the time. And those are really big factors that can impact what our behavior looks like. So for today, I'm going to talk a lot more about that sensory piece because that's kind of the bread and butter of what OT works with for those behaviors. So here is a little bit more information with the sensory processing. So behavior reflects internal and external sensory experiences. So we have 8 sensory systems actually. We've got touch, which is our tactile. This system helps us process things such as clothing that touches the body, different textures or items that we touch, physical interactions that we have. We have sight, visual input. This system processes what we see through our eyes, like light and dark, movement of people and objects around our areas. We also have smell, which is olfactory. This system processes odor, and our sense of smell is highly linked to memories, which can be really impactful on our moods, right? Think about a time that you've walked past somewhere and you've smelled maybe like a baked good or something, and it just takes you straight back to grandma's cooking, grandma's cookies, and you just have this flood of warm memories and you just feel really good based on that. Or like think of a time that you smell something that you didn't like. It was kind of a bad memory for you. Maybe something happened at that time, right? It might kind of automatically put you into a different kind of mood. We also have taste. This one is processing flavors and taste, so like our salty, our sweet, our bitter, our savory. We have hearing, auditory. This system processes noises and sounds around us, like pitch and volume, and it also determines for us if any sounds are dangerous or alerting or if they're calming. We have interoception, which is not one that gets talked about too often, but this system processes internal sensations within our body. So that's those feelings of hunger and thirst, and when we know that we need to use the bathroom, things that happen inside of us that we have to be able to kind of recognize and understand. And then we also have proprioception, and this system processes the relation of our body within space, and it helps regulate the amount of force that we need to move throughout our day. So how sensory information is processed directly impacts one's behavioral response. So I'll give you a little example here about maybe a child, you give a light child a pat on the back because you're trying to kind of give them a sense of encouragement for something that they're working on. And that child's sensory system is unable to organize the tactile information coming in properly. And for them, their body interprets this type of touch as a threat. And that manifests outwardly as aggression. So maybe the kid gets up and tries to hit or runs away. Another relatable example for adults too is, you know how angry you get when you can hear someone chewing out loud? And it's like the smallest sound, but it just throws you into a fit of rage when you can hear someone smacking their lips. Just how your body internally processes that sensory information, it comes out and it manifests physically often. And it really changes your mood and it changes the behaviors of what you're able to do. So it's really important to know how your child reacts to sensory input from these different sensory systems, because knowing how they interpret this information in their bodies can really help knowing what their responses are, and can allow you to be able to utilize their preferences and things that they are able to actively process in a way that you can use this for proactive strategies. So it's really important to know those types of things. And it's also really important to know that information about yourself as a parent too, because especially when we're younger and especially when we're learning regulation strategies for the first time, co-regulation is a big thing. And co-regulation is you working with your child to help regulate them. So if you're having a hard time regulating yourself, it's going to be really hard for you to help your child also regulate at the same time. So it's really important to know kind of like what things, how you process sensory information and what kind of strategies that you need to help you get through situations so that you can be in your best form for them. And this reminds me of that like saying that we hear on the flights all the time when they tell you that like when the oxygen mask comes down, make sure that you put your mask on yourself first before you help someone else. Because if you don't have the oxygen, how are you supposed to help someone else? And it's the same thing with this regulation. If you don't have regulation, how are you supposed to help somebody else regulate? So those are really important things to know. And to learn more in depth about like how your child processes stimuli, like in sensory stimuli, it's really important to consult a clinician to find out kind of like the big key pieces of kind of what's going on with that thing, because there's a lot of information that you can get about like high thresholds and low thresholds, which are all just really fancy terms for knowing how much sensory information and like how big of a cup does your kid have for sensory information and when is going to be their tipping point, and being able to figure those things out. But you can use a lot of observation to figure out kind of some really simple things and simple information about this stuff to use as those proactive strategies. So here's just a little table that provides some like regulation sensory strategies based on each of the sensory systems that can be used prior to, which is, the best thing that we can do is those proactive strategies. You can use them in the middle of or after daily routines, in the middle of non-preferred tasks or between them. You can use them as like sensory breaks to provide your kid with regulation that they need to kind of move on to the next task in their day. Kind of however you think is best and what works best for your kid. You know what works best for them. And you can also try things and then you can figure out, you know, did this work? And kind of using like that ABC data that Callie was talking about earlier too, you can kind of use those strategies and figure out like, okay, I implemented this. Did that one work? Maybe that's not the right input my kid needs for that sensory system. So I listed a couple of things here, and it's important to note too that this stuff is not a catch-all be all because there's a couple sides of the spectrum for each of these sensory systems, right? So for touch, something to note is that for a good majority of people, firm, constant, deep pressure is regulating, whereas really light tickles are very uncomfortable. I mean, think about getting tickled as a kid, right? Like sometimes it was fun, but there were sometimes that you were like, oh my gosh, this kind of actually hurts now. Like I might kick this person if they don't stop tickling me. So for a majority of people, firm constant pressure, it can be helpful for regulating. So giving like bear hugs, doing things where like you're playing with sand, you're squeezing stuff together, doing like a sensory bin, stuff like that. But in the case, if you have a kid who does, I have a couple clients that really love light tickles. It feels good to them. So just being able to like try something and notice the reaction of your child afterwards is really important. Because your kid, we all have very neurodiverse backgrounds. We all have different preferences, how we like things. So just because these things are listed as kind of like what the norm is, your kid could be opposite, and that's totally fine. But it's just important to remember, like, know those things. And these are just some ideas. So for like tactile stuff, something that happens pretty often is kids don't like seams on their clothes and they don't like tags. So being aware of if that's what's bothering them, getting clothes. There's so many clothes out there now too that have no tags or there's no seams, making sure that they feel comfortable in the clothes that they have, because you might see challenging behaviors when you're trying to get a kid dressed during the day and they're just screaming and crying and fighting it and telling you they don't want to go to school and you can't get your routine done because they have to put clothes on. Unfortunately, like at home, you could probably hang out without clothes depending on your age, right? What's appropriate. But you can't go out in public like that, unfortunately. So working with your kid to kind of find out and figure those things out, because maybe it never was the whole idea of just like the daily routine of the morning. Maybe it was the whole time that their clothes didn't feel right for them. And that's what set off the whole like chain of events for how, the morning routine goes so poorly for you. So being aware of those kinds of things. For sight, using like liquid timers, like projectors, you can do like shadow puppets, stuff like that. Watching bubbles. If your kid doesn't like, I think like a hot topic or a hot word these days is like people call the lights in the rooms big light. Like people are like, ugh, big light is so, I don't like big light. It's too bright, right? So if your kid likes dim, soft lights, things like that, or if your kid needs, brighter lights to help wake them up, those are some things that you can kind of think about changing within your environment. For smell, you can do any kind of like scented stuff, diffusers, scented markers. You can do stuff like, putting herbs and spices inside of crafts. So if you're like making a homemade Play-Doh, you could put something in there that kind of smells pretty strong. Flowers. And then on the opposite side, limit scents for sensitivities. So, use unscented Play-Doh or use unscented soaps, things like that, if they're feeling really sensitive to that kind of stuff. Meet them where they're at. For taste, doing things like crunchy foods can be really regulating, especially if you have a kid that's a biter. Chewing gum is another really good one for that. Kids who are seeking that input. Again, going back to Callie, it's so good to find out like what the function is of the behavior, right? Because if the biting is because they want some input into their jaw, then we have to find something that can do that. So like doing a chewy or eating crunchy foods, or chewing gum, stuff like that. If the biting is just because we're looking for attention, then those strategies aren't going to work for that one. So kind of figuring out those little pieces to be able to use these strategies to the best of your ability. For hearing, singing, humming, doing music, a sound machine. Sound machine is great for bedtime, to help kind of have that white noise to help with soothing to sleep. Headphones, earplugs for when we're in those noisy places, because we can't always modify our environment, but sometimes we can modify what we have with us to be able to tolerate the environment for what we need for the day. Interoception, this one can be a tougher one, but this is, again, because it's trying to understand the inside of our body and how that works. And it can be hard because you just don't know what your body feels like for certain things. Like there are still some times where my stomach growls and I'm like, I need food. And I'm like, I just ate 10 minutes ago. It's probably water that I need, right? So it's something that we're probably still working on as adults, but it's so great to start this so young and do like body scans. Okay, so how is my head feeling right now? Does it feel heavy? Does it feel light? Mindfulness activities where you're kind of taking more deep thought into yourself to understand those things and help them understand, like if you're having a kid who has a hard time with like a bathroom routine, sorry. Maybe it's not that they don't like the transitions. Maybe it's just that they haven't felt like they had to go, or they don't know when they feel like they need to go. So teaching them and talking through like, what are the sensations that you can feel when that stuff is going to happen? For vestibular stuff, this can be things like swings. A lot of times vestibular, it's about like head movement in space. So like swinging around, changing those positions, doing yoga, animal walk, stuff where you're kind of inverting the head position can really help get those kids some of that input. Wiggle discs when they're sitting on their chairs to give them some movement. Proprioception, heavy work is a really great one to do. It's really regulating to the body, but it's got to be stuff that's heavy. So like have your kids help carry in the groceries, have them, you know what? Maybe your living room needs to be rearranged. Have them push the furniture around and help you with that. You can fill up like a laundry basket on, textbooks, canned goods, put them all in there and have the kid try to see, like have a race, see if they can push it across the floor, in 10 seconds or things like that. Stuff that really makes the body work really hard can be really calming and regulating for your kid before bedtime or anything like that. So these are just some ideas of things that you can use throughout your day, depending on what sensory input is best for your child. Oh, the OT scope about this stuff too is, again, going back to remembering that behavior always has a purpose, and that being prepared is truly the best thing that you can do. So just like Callie mentioned too, it's always best to rule out any kind of pain or illness. So again, a lot of our kids, like I was kind of talking about with that interoception stuff, kids maybe don't understand. So what their body is feeling and what that means. All they know is that like something doesn't feel right and it's going to manifest outwardly. Think of being like a baby, right? A baby cries and there's no level of communication there. There's no gesturing they can do, things like that. The baby cried and you had to kind of figure out what was going on. Was it a hungry cry? Was it a sleepy cry? Was it I need to get changed cry? So kids might still be learning and needing more time to figure stuff out about their body. So making sure that like if something's happening where they're biting a lot, like maybe there's something going on with their tooth. Let's just make sure that we consult a couple different people to really find out like what the root cause of it is. And then we can know what professional is going to be the best one to address those things. But one of the really good things to do is build a routine. So just like many of us as adults, kids are way more successful when expectations, environment, people, and situations are familiar. I have social anxiety myself, so I feel this one so hard. I really like to have predictable things. Like I know that I need that as an adult. And sometimes our kids can't tell us that that's what they need, but it can be a really helpful tool for them. So making sure that you're trying to stay consistent, even if it's going to be a situation where, like we can't always be prepared for every single situation that there is, right? We're going to be in new places, we're going to do new things, and stuff is going to happen. So even if you are the only thing that's consistent, right? Your co-regulation techniques, making sure that's consistent, can be a game changer too, even if there's other things that we can't control. A really great part of this too, of building that routine, again, is the expectations, right? Because uncertainty about expectations can lead to challenging behaviors. Because if we don't know what is expected of us, how are we supposed to know what we maybe didn't do correctly, right? So we really need to make sure that we're kind of making these things expected. So like I have some pictures over here of visual schedules and things like that. So being able to show the kid like this is what your daily routine is going to look like in the morning. Like we're going to wake up, we're going to get dressed first, maybe we're going to go brush our teeth, we're going to go to the bathroom, and then we're going to go eat breakfast, get dressed, go to school, right? Like let them know what is expected of them exactly, because that makes it easier for them to get up and start being more independent with these things and going about doing some of this stuff on their own. Again, these visual schedules can be super helpful. You can use these for things that are similar day to day, or you can make ones that are customizable so that when you have something like a change, like maybe you've got to pick up little Timmy from school early on Friday because he has a doctor's appointment, putting that in there earlier in the week and like talking through what the expectations are going to be at the end of the week and giving them that priming and time to process before you just throw them into that situation can be really helpful. And of course, again, I know that that's not always possible, right? Things happen, stuff comes up, but the more that you can be prepared, the better it's going to be. And it gives you opportunities to work on their strategies so that when you have those unexpected times, you have that toolbox of strategies you can pull out and use in those unexpected situations. So this really helps set it up really nicely for these kids. And then kind of going back to like the chart that I was just talking about, use your sensory strategies throughout the day. It used to be called like a sensory diet, which was a little confusing for people because people would be like, I eat stuff to help my senses. Sometimes you do if you're looking for, like oral kind of stuff, but we call it kind of a sensory lifestyle now. So from that chart of things that I was listing, finding out the things that your kid really enjoys to do and that make them feel better and help calm them down and regulate their body, and using those throughout their day. Use those proactive strategies. Do it before you're about to do a transition. Do it in the beginning of the morning so that their body feels regulated and ready to handle all the sensory stimuli that's going to get thrown at them at school. Use those sensory strategies as much as you can, and you can do it, like between every activity. You could do it in the morning, the afternoon, and the night. You could get your kids involved in sports like gymnastics or like taekwondo, things like that give them a lot of input. And that can be kind of like their sensory strategy that they use. But having the kid's body be regulated and in a position to intake all that sensory information is going to help them be able to process that information and have those like appropriate responses that we're looking for. So another thing for us too is transitions can be really hard for kids. So again, trying to kind of pre-warn kids about transitions when things are going to stop. A lot of kids have a really hard time when they're doing something preferred and then they're asked to go do something non-preferred. So being able to target these transitions specifically can be super, super helpful. So like adults, we have the ability to watch a clock and be aware of time passing. So that we can anticipate a pending change. Children don't have that same strategy. So to them, oftentimes transitions can feel really arbitrarily imposed. They don't really know time. So sometimes when we tell them verbally, like, okay, we got 2 minutes left, also sometimes like I'll forget that it's been 2 minutes and then it's like 5 minutes later. I'm like, okay, so kids don't always have the greatest sense of time. So trying to use transition techniques can really help it make it seem more like it's not arbitrarily imposed by your parent. This is like a way that we can track it. And so one of the things is going to be using like timers and stuff like that. Using maybe a song to transition from one place to the other, using an object that they get to take with them from a place to another, doing a movement. One of my favorite things to do at the clinic is to do floor is lava. We have different colored tiles. We have like blue, green, and white. And so I'll let my kid pick which one's the lava, and then we have to go hop on the different colors to get out to like the bathroom, or we have to hop on the different colors to get out to mom at the end of our session, using some of that kind of movement stuff. But a good thing to point out too here is the timers, right? We don't want to use timers only for transitioning away from preferred things. Callie gave me this great reminder when we were chatting about this stuff together too, that, sometimes we use those timers because it's great because we get to have that visual of watching the time go down, which can be really helpful for some kids. Some kids might get too attached to watching the timer and things like that. So if it's an appropriate tool for your kid, just make sure that we're not using it only when we're moving away from preferred activities, because then we're going to have the timers become aversive if we're only doing it then. So even today I was doing some sessions and I was using my timer to transition out of the gym, but I was also using our timer to transition back to the gym. So I was using it in both senses so that it would be like moving away from a preferred thing and then getting to go to a preferred thing so that we didn't have an aversion to using the timer. But my friend really benefited from being able to know how much time they had left before we had to go do the next thing. Doing things like alternating preferred and non-preferred activities, use a preferred activity to help break up non-preferred tasks and help build some of that motivation and momentum in those non-preferred activities. And then another really good thing to remember too is keep perspective, right? So despite how much you're going to try to use these preventative measures, behaviors are still going to happen, right? It's just what it is. Kids are always learning and growing, and they move through stages of development and independence and learning where their capabilities lie. So be as prepared as you can for situations, but also understand that like with new growth, there's going to become new challenges. And despite what you try, some of that stuff is still maybe not going to work, but like, you know, you're going to be able to kind of look through and reflect on what you did and figure out what can we do differently. Or, if you're going to seek out help from clinicians, they're going to help you figure out like, okay, this strategy didn't work, we're going to find a new one. So just keep that perspective that like this stuff isn't going to work 100% of the time, and that's okay. Even as adults, we still have those moments too where we're like, I know my strategies, but like, I'm not going to use them today. I'm really frustrated about this thing. And it happens. And then we know next day we're going to start and try again. A couple other pretty quick strategies I have here that are kind of outside of sensory, but like you can use sensory stuff within these things. Is minimizing aversive events. So using like chunking techniques, right? So again, it kind of talks about the bottom. The last one that I wrote on here is matching the demands to the abilities. So one of the like hot phrases that we use in OT is the just right challenge. So we don't want to be doing something that is way too easy for the kid to be able to do because we're not challenging their skills and promoting that growth. But we also don't want to be doing something that's way too challenging for these kids. So we want to find that just right challenge where it's kind of promoting that independence and that skill growth, but it's not to the point where we're really frustrating these kids. So things like using chunking then, right? Like maybe you get given a homework assignment and you sit down and you're like, all right, before you can go play outside, you've got to finish this whole homework. That kid might be like, I'll never be able to do it. I'll never be able to finish this whole thing. Like maybe it's a math homework. I really struggle with math. Like this is going to take me 5 years. I don't want to do this, so the kid's going to give up on it. But maybe it's like, okay, hey, do 2 problems, and then we can take a little sensory break, snack break. Let's do 2 more problems, chunk it into smaller things that feel more manageable to the kid because you're going to get more participation and then you're going to have more success. I think I saw some things popping up in the chats of this one too, but the sharing control, give options, right? So even sometimes when I'm telling a kid that I'm going to set a timer, I'll ask them and I'll say, do you want 2 more minutes or 3 more minutes, right? Because it makes them feel like they get to make the choice. They're picking the thing, even though I've pre-set up the options that I want to give them and the ones that I want them to choose. So I'm like, whatever, I'm cool with you picking 3 minutes. That's totally fine. So they come back and they're like, I want 3. And you're like, win-win, here we go. That's great. Give those options too. I'll be like, do you want to ride a scooter to go to mom in the hallway? Or do you want to have a piggyback ride? Providing those options where it gives it kind of something fun, but the kid has some of that choice in it. Provide an environment that promotes successful engagement. So this kind of goes back to that sensory stuff. So a lot of stuff we do in OT, and I think a lot of the school systems use this one too, is the zones of regulation. And being able to use this is also helpful in the one that says support self-regulation. But being able to know what a kid likes for sensory pieces and setting up their environment like that, right? So if a kid is really sensitive to sounds, giving them headphones where they can sit in class if they're getting distracted by peers or having a hard time with peers. Maybe at home you're working on homework, giving them a quiet space, a space with no clutter on the desk that helps them with being able to focus more on what they're doing. Giving them like there's a picture here, that little blue disc is a wiggle disc. It's got one side's got some more spikes and the other one's got teeny tiny little bumps, depending on what the kid wants, but it lets them wiggle in their chair. So it lets them get movement if they have a hard time sitting down to do like tabletop tasks. Making it so that their environment also helps promote the most success for them and using sensory strategies that you might need for those things. Another thing is just kind of a little plug to our SLPs is increase communication effectiveness. So for this one, it's hard to kind of come through and like some of our kids don't have a super effective means of communication, and that can often cause behaviors because a kid is trying to deliver a message and they just can't deliver it right. We know pretty often like enjoyable activities and pleasant experiences, people communicate that through like a smile, a hug, or clapping. But sometimes things with like pain or undesired activities or frustration, that tends to kind of come through as what we deem as inappropriate behaviors, as like hitting and biting and screaming, because the kids know that doing those things sends some kind of message to parents. So really plugging that, if your kid needs help with some of that stuff, that SLPs are a great resource to help kids expand their communication and be able to figure some of that stuff out. And that also kind of comes into this zones of regulation as well, that this provides a pretty easy color-coded system that we can kind of talk about or learn about the way our body feels in different zones and make it something colorful for kids to help them be able to express that stuff. SLP, sorry, stands for speech language pathologist. I should have said that out loud. I apologize. And then again, touching on the last one too is the matching the demands to the abilities, just that just right challenge, right? When performance demands exceed an individual's abilities, that person can become really frustrated and angry and aggressive. And when demands are too low, people can become really bored with what they're doing. So making sure that we're finding that just right in between for these kids. Awesome. Okay, so we're going to give a couple examples here. We've got some practical scenarios that we're going to talk about. So this first one is scenario 1, and we're talking about running and playing at bedtime, and I'm going to let Callie go off first.
Hi, I'm back. So I added a simple one-line example of recording ABC data, so that antecedent behavior consequence data that I was talking about, to try and figure out why the behavior is happening. This ideally would be able to continue to note the environment before and after multiple times to find patterns, so we can see if there are multiple reasons or if that one reason is the true reason. But for the purpose of this, I just did the one. So for this scenario, the antecedent is mom saying, "It's time for bed, let's go get ready." And then the behavior is that the child then runs and maybe plays, maybe they're ducking away or trying to play tag, which then as a consequence, it takes longer to go to bed. So we may note that the possible function would be escape. So some proactive strategies that I might have. So before even getting into the bedtime routine, maybe I just already know the history. I know that this happens every night at this point. So some things that I might start to use is maybe including expectations with a visual and a timer. So that goes back to also what Sierra was saying of just having that clear expectation. You can provide choices to make bedtime as exciting as possible and to give your child a sense of autonomy. So maybe choosing where Teddy is sleeping, what pajama set you're wearing, or maybe even if they're going to bed at 8:20 or 8:30. So really carrying over a lot of just both of the ABA and OT strategies. And then reactive strategies. So let's say it already happened. Here's what I would likely do in this scenario. Remember, every situation is unique. But maybe I would model asking for more time and then honoring their communication. So if I say, "Oh, it seems like you maybe want some more time. Do you want 10 more minutes?" And if they say, "Yes, I want 10 more minutes," I would honor that. And then once the extra time is provided, we can follow through with that expectation by remaining neutral. Maybe I can block and redirect them if that's physically possible. And then once they begin to follow through with the bedtime routine, show them that they're doing a great job in whatever way is good for them. Maybe it's through being silly, playing a game with them as they go toward bedtime, or even smile and praise.
Yeah. So from that OT perspective, I wrote R&R, routine and regulation. Those are the two big pieces that we really kind of want to pay attention to here. I also kind of want to go back again to this one is just an example of how it could go. But again, it's really important to know the function and the why behind what is happening here, because the kid could be, maybe they're having nightmares at night and that's why they don't want to go to bed. It's because they're too scared to go to bed. Maybe it's because they don't genuinely feel tired. Their body still feels very awake and they're like, "I'm going to go lay in bed and I'm going to be so bored." Because remember, that's, being bored and not having what they need to kind of stimulate their brain can be like, cause some behaviors and things like that. Maybe it's just because they just can't get comfortable or they don't like sleeping alone. So just make sure that you're finding out kind of what the true reasoning and why. But with all of those things still, setting up a nightly routine, right? So just again, setting up those expectations to make it easier to follow. Routines create a habit, right? And habits are really helpful for people. So using that, you might not have to use a schedule every single time, but like I have a nighttime routine. I know exactly what order I do things before I go to bed, and I do that every single night. And that always helps and set me up for getting in the mood to understand that I'm going to go to sleep and that my body needs to start shutting down. So that can be really helpful. So you can use those visual schedules here to help depict those expectations. You can do like word visuals, you can do picture visuals, you can really do kind of like whatever you want that your kid understands and makes it more fun for them. I've made visual schedules where I've used like the kids' favorite, like movie characters to help depict different things. Stuff that gets them involved and motivated to want to use those visual schedules as well. Another good tip that I usually give from that sensory perspective is engaging in whatever sensory input is most calming for your kid an hour and a half to 2 hours before bedtime. We don't necessarily want to do it like right before bedtime because we don't want to rev up their sensory system and kind of wake them back up. But providing that regulation 1 hour to 2 hours before kind of lets that regulation set in and the body kind of process that information and help calming them down and regulate them for like this bedtime. Again, the type of sensory input that your kid is going to want or need to help regulate themselves is going to be totally dependent on your kid. And this is also too just another thing, like when you're looking at that table of what kind of sensory input to use, just remember too that just because your kid likes a sensory activity doesn't mean that it's regulating for them, right? So a lot of my kids love to spin in circles on the swing. Circular motion is really arousing to the sensory system. So just because they like it doesn't necessarily mean that it's good for their body though. So you can use those as like, let them do those things at break times, but when you're trying to use specific strategies to help with regulation, make sure that you're using activities that do actually look like they're helping regulate their body and calm them down. So like I said, heavy work is a really big one that can be helpful. So like the pushing, pulling, carrying heavy items around. Other calming sensory input before, like you can put within your actual bedtime routine is doing a warm bath. That's really calming. Having a weighted blanket while they're sleeping. Doing some rhythmic movement, right? Like, when you've got an infant, you're doing a lot of rocking in a rocking chair, and that helps get them to fall asleep. So engaging in something that kind of mimics those movements. Lotion and massages can be really relaxing to the body. Set up your environment, right? Using dim lights while you're getting ready for bedtime. So like maybe your bathroom's got, the really big fluorescent lights. Maybe you put some kind of other light in there that's a more dim one that kind of sets the mood while they're doing their routine. Reducing noise, using that noise machine to help kind of dampen any other sounds. Avoiding blue light stuff before bedtime so that their eyes are getting sleepy. Keeping a cool room, using like lavender, eucalyptus. Those are all kind of strategies that you can use to help set up your environment to kind of help that kid get to bed. And sometimes I tell families too of using those options here too, right? Like, do you want to bear crawl up the stairs to go to bed, or do you want to piggyback ride to get upstairs to go to bed? Like adding some of those more fun things in there that provide the kid with some choices between that stuff as well. So our scenario number 2, we're going to talk about a scenario of screaming in the grocery store.
All right, so once again, I have the ABC data to figure out why it might be happening. So for this scenario, the antecedent is walking past the candy aisle at the grocery store. The behavior is screaming, which then leads to the consequence of dad giving the chocolate and telling them to be quiet. I know it sounds like something that people will be like, oh no, we wouldn't do that. But in the moment, we're talking about your own regulation, and we're talking about maybe being in a public space. I know I'm guilty of it myself, where I'm like, I just want to get through this grocery store and I'm not thinking about the long term, right? So with this scenario, we can think about the possible function as tangible or access to the candy bar. So proactive, maybe ahead of time going into the grocery store. Some strategies that I might use could be to ensure that they've eaten prior to going into the grocery store. Maybe they're hungry, and the reason that the candy looks extra exciting is because they just haven't eaten yet, you know? So similarly to before too, you can set the expectation with a verbal or a visual schedule. You can let them know ahead of time whether they are or are not going to be getting a treat. And if you're able to and planning to get the candy for your child, you can even model appropriate asking. So this can be making a scenario ahead of time, maybe saying like, okay, and when we get there, what do we say? Or maybe it could be when you're in the aisle, you could model saying, I want the candy bar, or can I have the candy bar? And then reactive, let's say that the behavior is already happening. I want to remind you also to be kind to yourself. I know stressful situations happen, especially in public. It just adds to the stress of it. But try your best to remain neutral and then follow through with the expectations. So if you need to leave the store for your own sanity, you're human, give yourself grace. And then if they scream about the candy, at that moment, you can just remain calm and you could even stay in the store. It's up to you. And then if they later ask calmly for something else, maybe a bouncy ball, if it is within your budget, I would encourage to then get them something else, an alternative, so that you can teach them the appropriate way to respond or ask for the items. So this might be a little bit of a longer follow through of like, you know, every once in a while going to the grocery store with that expectation that I will be buying the item for them. And then giving yourself, I think the most important thing in public scenarios is just giving yourself grace and remaining calm.
Yeah, okay. I'm gonna rush through mine real fast because I know that we've got questions. So again, provide the explanation of what's about to happen. Make those clear expectations of kind of how the adventure is going to go. Make it fun, and how it's going to go and what kind of you're expecting, like behavior wise from them. And then have sensory strategies ready to go, right? So like as an example, you're saying to your kid, we're going to the store and we're going to find 8 grocery items. Well, I made a list that we're going to follow. Maybe let's pretend to be pirates and we're looking for all of this treasure on my list. As a pirate, we have to have a safe body. We got to pay attention to where we're going. We got to keep an inside voice and we got to use a just right speed through the whole place, really laying out exactly what you expect from them. You can even use then like sensory strategies, right? And being like, maybe your kid really does well with like weighted vests or something. You can be like, here's your vest. Every pirate needs a vest. Put it on. Let's go find our treasure, you know? Or maybe your kid really likes a stuffed animal and you can be like, you can pretend like your stuffed animal is a parrot. Like stuff like that, and kind of being like, let's make it fun. And again, you're not gonna be able to do this every single time. There's not always the capacity, but it can be a good way to set that stuff up and set up the expectations in a fun way so that the next time you go to the grocery store, your kid knows what the expectations are. And maybe your kid's gonna be the one coming up with a story and being like, great, I'm gonna make up a story about being a pirate, or I'm gonna make up a story about something else, you know, and like kind of give them that creative outlet. Focus on that regulation, remain calm if something does happen, use a soft voice and use good body language, use minimal words and minimal visuals to help do that stuff. Provide some preferred regulation stuff, gentle, firm, you know, compressions on the shoulders, arms, head, wherever your kid likes it can be really helpful. And then try other regulation strategies. Oh my gosh. If you feel like it isn't going to escalate the situation, and then later reflect on what happened if something went wrong. Talk about it a little bit later, you know, when you're a little bit removed from the situation, validate their experience that like maybe that was really tough for them, but they tried really hard. And then practice some of those regulation strategies and be like, hey, next time we go in, I know you had a really hard time. Let's use these strategies and we can use it towards that. So just some tips.
Awesome.
These are
And
just some
we have a
resources.
couple,
Yeah.
I was just going to say, we have a couple resources, and in the recording, we'll have this on here too, as well as the slides. So you can always check these after. So we want to leave a little bit of time for questions now. So I know there's a lot of questions and stuff in the chat. So first off, I just want to repeat the disclaimer that Callie had talked about earlier. And basically, since everybody's in a different situation, our clinicians can't provide specific recommendations for each individual child's situation without adequate assessment and more information. But please, if you do have a specific scenario, reach out to help for help if you're, interested in speaking with a clinician one-on-one or consulting and starting services at NSBT. Our information is listed there below. But I guess I just want to open it up to Callie and Sierra. I know you guys have been kind of seeing the chat as we've been going through. Is there any specific situation that you want to expand on, maybe get some more tips? We have a lot more of those kind of situations and questions. So I'm not sure if there's something you might want to touch on there.
Yes, so I have seen quite a few of these questions in here that are very scenario-esque. And so I just want to give a little background information too about why we're not able to give specific feedback on it. So just in case, let's say the scenario, I give you this advice and the function of behavior may seem one way. Maybe I'm thinking, okay, for sure, this seems like they're sensory seeking. And then I tell you a tip or a trick that would help with the sensory seeking function. And then it maybe spirals and it gets worse. And then maybe something happens because I did not know the full function and I didn't know the learned history. So I just wanted to give that little disclaimer too, or like some kind of background information on the disclaimer. Yeah.
I'm trying to read through.
Sorry, yeah, no, I was reading through a little bit too. So I wanted to start off just with some of the impulse control specifically questions, because I believe that came up more than once for sure. So just, I think Sierra, you definitely would have more information on the impulse control, but just from a ABA perspective of impulse control, I would say a lot of it would be just to provide those clear expectations and follow through. So I think a lot of times with impulse control, a lot of it comes from a child not knowing the expectations or knowing and being upset with the outcome, right? So just some things that maybe take a little bit more help, and a visual aid could really help, and that consistency of always following through would be something that would be able to help regulate and learn those skills for the future. But Sierra, I'm sure you can elaborate further.
Yeah, I know the impulsivity one can be really hard, right? Because it's kind of like that information comes in and you have that gut reaction. So, outside of that time, talking to kids about different strategies that they can use when they feel that impulsive like behavior coming on, and like teaching them stuff like I was just teaching a client the other day, like stop and think. So this friend kicked something in the big gym that was being used by another therapist, and we did a little bit of like perspective taking on it. So if your kid can do that, doing some perspective taking and being like, how would you feel if that stuff happened to you? But also again, like doing it removed from when it happens, because they might not be in the best state to have that perspective taking, and learning some of those things and how they would feel, and understanding that other people would feel the same way, and teaching them a strategy of like stop and think. Sometimes for like impulsivity with like blurting things out, I tell kids that like if they have something to say, pretend like they caught a bubble in their mouth, and they have to try so hard not to pop it. Things like that. But also again, like as Callie said, kind of that follow through piece, right? We obviously don't want to get like, if you say no to something and then a kid is, throwing things at you or stuff like that, just kind of following through, like that behavior doesn't get us what we're looking for. And then making sure that we're providing that reinforcement, even at the slightest thing. So maybe even at first with some of that impulsivity of like saying no, maybe we start with the expectation of no, or we have to wait. It's like 5 seconds, and building that up and teaching them that like, okay, I've said wait for something. Because a lot of times as adults, you're doing something and your kid's like, Mom, can I have this? And you're just like, wait, and give me 2 minutes. And then like 20 minutes later, the kid's, can I have this? And you're like, wait a minute. And so again, it goes back to that arbitrary piece of like, they don't understand time and some of that stuff. So like maybe doing it slower and building that up, building the wait time, or like different things like that can be helpful. But yeah, those are just some preliminary ideas.
Mm-hmm. And I know too, it's helpful for following through with things if you make sure that the goal is very achievable. Maybe if your expectation is that they come and finish their entire sheet of homework and they're having a really hard time with that, break it up and maybe have a little bit of the homework first, follow through with the first question, and then they can earn that break or that reward or whatever the then in this visual or verbal schedule that you're providing. And then you can just break it up into smaller, more digestible pieces for them so that it truly might feel like the end of the world to them, like this is the way that they're able to communicate and the way that they're processing information. So yeah. And I also saw another question about getting someone's attention when feeling ignored and being the class clown. Something I also like to say is just make sure that you are providing that attention in other spaces. I think it's really easy for people to say like, I'm just going to ignore them. They're talking and they're not supposed to be talking. I'm just going to ignore them and they'll stop talking. But making sure you're filling that need, and that way that they're trying to communicate is that they need more attention. Maybe you're not paying as much attention to them talking when they're not supposed to be talking or doing something as the class clown, but you are paying attention to them in other realms. So like if they're sitting nicely, going up and just talking to them, or giving them the space to talk in another way, maybe through a presentation or just telling jokes.
Another thing I was seeing too was some stuff about transitions. And I think that it's a really important thing to kind of do your own perspective taking too, and kind of put yourself in the kid's shoes of, like I think I saw, for example, someone had mentioned in here about like you're watching a television show and then the next thing is they have to put their coat on and shoes and leave, right? You're telling me I have to stop doing my absolute favorite thing in the entire world to go do my absolute least favorite thing in the entire world? Like that's going to be such a tough transition. And again, I know that like schedules are hard and sometimes you're running out the door last minute and you don't always have the opportunity to do these things, but making sure that you find times to practice this stuff. So like also maybe practice these things at a time where you don't actually have to leave the house, but you're going to practice it in a time where it's less stress, because that, remember, you have to be regulated too. And if you're stressed about leaving and being on time, that's going to make it really hard for you to kind of co-regulate with your child during those times. So practicing outside of that. But something that can be helpful with learning those transitions too is to start off with transitions from something really preferred to something else also preferred, but a little less preferred. So like, I can't think of anything exactly off the top of my head, but it's kind of like, okay, maybe they're doing this, like watching this TV show, but maybe they can go play with their doll for a little bit before you make the transition. So like taking that step down, not being from like best thing ever to like worst thing that they have to go do, and kind of doing like a step ladder to get down to that. And then the idea obviously is that as you practice those skills and use those strategies throughout those transitions, is that you're going to be able to make those steps bigger to go down. And then eventually you're going to be able to go, you're done watching TV, we got to leave the house now. And your kid's going to be like, great, I got my strategies, I know how to do this. So kind of, again, like chunking that into easier, more manageable things, and practicing that. And then again, practicing this stuff outside of when you really need to use them, because that's going to set them up for the most success and the ability for you to teach them about it and learn about it and not be so stressed when it doesn't go right.
Absolutely. That's something I was going to mention earlier too. I'm glad that you mentioned. I can only imagine, if someone's like, if you're furious and someone tells you, take a deep breath, you're going to hold your breath until you turn blue. You're not going to take a deep breath. So just making sure that you are practicing outside of or in positive environments so that you have the skill set. But yes, I think that is very important too. And that's a good, anywhere for any situation, just continuously practicing these skill sets, especially with that functional communication. You want to teach them how to communicate what they want. Maybe if they want your attention in a public mall, it might be, or maybe not a mall, maybe like a public gathering, like you're at a party with friends and they're tapping your arm and you're not paying attention to them because you're trying to finish your sentence. All of a sudden you turn around and go, what do you need? Now they've learned that if they maybe tap or even hit you, you finally will turn and look at them. But if you're practicing the skill set outside of, maybe you're at home and you're teaching them how to tap on your shoulder, or you're practicing maybe in some other environments, that when you are in maybe a more public gathered space, it also could be good practice for you to be more mindful and, oh, they're using their strategy. Nice. I can teach them. Tell them, hold on one moment, or even just tell the adult, oh, we're working on this. Hang on one second, So That's my little spiel on that.
Awesome. Well, thank you guys so much for all of the helpful information, and thank you everyone for joining. Like I said, we'll be sending out the recording to the email that you used to sign up for the webinar, and then we'll also have it available on our YouTube page and our social media channels as well. But thank you all so much for attending. Bye, everyone.
Bye, thank you.